And joining us live on the broadcast this minute is Rivka Abulafia Lapid, Senior Lecturer at Hebrew University Medical Center from Jerusalem, Israel. Thanks very much, Rivka, for speaking with us. Rich nations have bought over half of the world's future supply of a potential COVID-19 vaccine, according to a report by Oxfam International. A handful of these wealthy nations, representing only 13% of the global population, have bought 51% of the doses of these possible vaccines that are still under trial. What about the less developed countries? What efforts, according to you, should be made so that they do not lag behind in this race to grab vaccine doses and that there is equality in distribution?
Well, that's a good question because large scale of the vaccines you mentioned, the Moderna one and the Pfizer, they will be ready by the end of 2021. And indeed, you have to synthesize this RNA, the part of the vaccine, the major part of the vaccine. But luckily, we are hearing recently that Germany is developing another vaccine that is similar to Moderna and Pfizer. It is also composed of RNA. It is stable and better in a way of delivery. It doesn't need the minus 70 degrees or not the minus 20 degrees of Moderna. And again, it's very difficult to reach billions, 9 billion, the whole population of the world. And that's why there are so many other companies that are underway of starting phase 2 and phase 1 and under development. But I would like to mention the CureVac, the Germany and headquarters Tübingen, which is very promising, as I said. There is also the Oxford AstraZeneca, and there is also a couple of companies, two from China. There is the Russian vaccine, which is, in my mind, it's a very good vaccine because it was already tested in Ebola, but it has to undergo the clinical phases 1, 2, and 3, and I think it's not yet on phase 2 even. But this, we need to get more like open information and reports from the Russian. But Sputnik V was also purchased by Israeli, by Hadassah, head of the Hadassah. And so it's a good one. There is also the CanSino that is constructed on the adenovirus, which is also a good one because it was tested before with adenoviruses. These are other vectors.
Rivka, absolutely. Let me just... Yeah, sorry to interrupt you there. There are several logistical challenges that lie ahead. Now, as you're telling us, several rays of hope in this fight against COVID-19. But how can countries, according to you, overcome the logistical challenges and the hurdles that lie ahead?
Well, when you are trying something very new like RNA and it's unstable, and when you have to deliver it in a very not that easy technical conditions, like very cold. There are DNA viruses. Sorry, there are attenuated viruses like vaccine, which are much more stable and under development, including your country that is trying attenuated virus or inactivated virus. Then you can grow in a way in large scale and deliver it. So there are different approaches. In each one of the approaches, there are advantages and disadvantages. But because all over the world we are together and it's gathered in this way of doing the best and delivering the best. And I hope it's going to be also well controlled for side effects and for the efficacy and outcome. I think we have to really challenge most of the companies, all the companies that are underway of developing the vaccine, so it will be delivered for like Africa and other countries, and it will be even cheaper. So we have to make it also cost valuable in a way that the delivery and also the vaccine is going to be much more easy to produce and to send, to deliver, and to be used in other countries. I'm very optimistic, and I think by the end of 21, most of the population, I don't know if not most of the population, but very vast majority of the population will be able to get the vaccine. I know that some companies are having some money from their countries. I know that Melinda. I know that some companies have contributors. So I think the efforts are really great. So, like Bill Gates and Melinda, I know that they have some input also in one of the vaccines, which is very important. So the more it will be understand, now countries understand that, governments understand that, they know that we have to support everyone. Even, in Israel, we have the Nes Tzionah vaccine, which is also very good and very promising. And I guess it will be also in a short while. We are right now in phase 1.
Yes.
We'll have it also. So I know that Chinese, trying 2 kinds in China. I know that there are so many that...
So we do have these positive developments vis-a-vis the vaccine race. We will have to see how these countries end up actually overcoming the challenges vis-a-vis distribution now. We're going to leave it there for the moment. Rivka, thanks very much for joining us with those perspectives.
Yeah. It's a